why being human is morally enough. When we ask the most basic question in bioethics, who counts morally, we are not asking a medical question. We are asking a foundational moral question. And one of the oldest, most influential answers to that question is this: if you are human, you matter morally, full stop. This is known as the biological or species membership theory of moral status. Its core claim is deceptively simple. Being human, biologically, is sufficient for moral status, not intelligence, not consciousness, not autonomy, not self-awareness, just being human. This theory begins with a rejection. It rejects the idea that moral worth must be earned by mental performance. It rejects the idea that humans only count if they are rational, articulate, productive, independent, self-directing. Instead, it insists on something much more radical. Moral worth is not something you achieve. It is something you possess by virtue of what you are. At the heart of species membership theory is a moral intuition most people already hold, even if they've never named it. We do not say that a newborn must prove rationality to deserve protection. We do not say that a person in a coma has temporarily lost their right to life. We do not say that a person with profound cognitive disability is less human in moral terms. We protect them precisely because they are human, not because of what they can do, but because of who they are. This theory draws a firm moral boundary. All human beings possess equal moral worth. No sliding scale, no hierarchy of value, no moral grading curve. A premature infant and a Nobel laureate do not differ in moral status. A person with advanced dementia does not lose their humanity. A permanently unconscious patient does not fall outside the moral community. The moral community is defined biologically, not psychologically. One of the great strengths of this theory is its simplicity. You do not need brain scans to determine moral worth. You do not need consciousness tests. You do not need IQ thresholds. You need only one question: is this a human being? If the answer is yes, moral status follows. This makes the theory not only philosophically clean, but ethically protective. That protection is not accidental. Historically, whenever moral status has been tied to capacities, intelligence, rationality, autonomy, productivity, the result has been exclusion. Infants excluded, the disabled excluded, the elderly excluded, the unconscious excluded. Species membership theory exists, in part, as a moral firewall against that history. It says we do not measure human value by function. We recognize it by kind. This is why the theory aligns so naturally with human dignity doctrines. Human dignity does not fluctuate with health. It does not increase with education. It does not diminish with illness. Dignity is inherent, and species membership theory provides a clear grounding for that claim. Human beings possess dignity because they are human, not because they are useful, not because they are aware, not because they are autonomous, but because they belong to the human family. This is also why the theory sits comfortably within many religious bioethics frameworks. Judaism, Christianity, and Islam all affirm, through different theological languages, that human life has a unique moral standing. In many of these traditions, that standing is linked to creation, divine intention covenant, or the idea that human life reflects something sacred. While species membership theory can be defended without religion, it maps naturally onto religious moral reasoning. It protects life before it can speak for itself. Legally, this theory underwrites much of constitutional and human rights law. Human rights are not granted based on intelligence tests. They are not revoked when cognition declines. They apply to humans as such. That universality is not a coincidence. It depends on a biological definition of who counts. Once moral worth is tied to mental capacity, rights become conditional. Species membership theory resists that move entirely, but no ethical theory comes without critique. And the most common critique of species membership theory is blunt: speciesism. Critics argue that grounding moral worth in species membership is no better than grounding it in race, sex, or nationality. Why should belonging to Homo sapiens matter morally? Why should biology alone carry ethical weight? If a non human animal can suffer more, feel more, or be more aware than a human infant, why should the infant automatically count more? This is not a trivial challenge. The critique forces the theory to answer a hard question: what is morally special about being human? If the answer is because humans are more intelligent, the theory collapses into a capacity-based view. If the answer is because humans suffer more, it collapses into sentience-based ethics. Species membership theory must defend humanity as a category, not as a bundle of traits. Supporters respond in several ways. Some argue that moral communities are kind-based, not capacity-based, that belonging to a moral kind carries obligations regardless of individual variation. Others argue that shared human vulnerability, embodiment, and life trajectory matter morally in ways that isolated traits cannot capture. Still, others argue that once we abandon species boundaries, we lose any stable grounding for equal rights at all. Whether these responses satisfy critics depends largely on one's ethical commitments. But the debate reveals something important. Species membership theory is not naive, it is protective by design. It deliberately prioritizes moral safety over philosophical elegance. It would rather include too much than exclude the vulnerable. It would rather draw a clear line than risk moral triage. And this explains why, despite criticism, the theory remains deeply influential. It is embedded in law, it is embedded in medicine, it is embedded in religious ethics, it is embedded in everyday moral intuition. Most people already live as if it is true. They may not say species membership theory, but they act as if being human is morally enough. In future lectures, we'll contrast this view with sentience-based ethics, personhood theories, and gradualist approaches, and we'll see exactly where these frameworks collide. But for now, this theory leaves us with a stark and demanding moral claim. Human life does not need to justify itself. It demands recognition simply by existing, and whether one accepts or rejects that claim, it remains one of the most powerful foundations in all of bioethics.